October is Breast Cancer Awareness Month, and it's one of the most common forms of cancer in the United States. Joining us now to discuss, Dr. Thomas Buchholz, Medical Director of Scripps Cancer Center. Doctor, good morning, and thank you for being here.
Thank you.
I was just telling you when you walked in, it feels, well, no, maybe it's just social media, or maybe we really know somebody now who's dealing with cancer, especially breast cancer.
Yeah, breast cancer is a common disease. Approximately 314,000 women are going to develop breast cancer in the United States this calendar year. So
just this year?
Yes.
Why? Where are the numbers coming from? Is something changed in our environment, in the way that we're living?
There are some risk factors that are changing. Age at pregnancy, age at first pregnancy, for instance, in Western civilizations, including the United States, is getting to be more protracted. Women are having children later in their life, and that's one risk factor. Alcohol consumption is another modifiable risk factor that one could do to minimize the risk of cancer. But most breast cancers just develop, and increasing age, another positive thing that's happening. Women are living longer because of less cardiovascular disease, and so breast cancer more commonly is occurring in elderly patients, but breast cancer in the young is becoming more common.
I can count on my fingers like how many people I know, friends or women that I know who they are, that at a very young age, no history of cancer in their family, and having children, 40s, turning around, all of a sudden you've been diagnosed with breast cancer.
Well, it's important that women understand that breast cancer can develop relatively early, and now the current screening mammography recommendations start at age 40, and I would encourage all women on their 40th birthday to come in, schedule their first mammogram, and have regular screening biannually or every other year. It's important, and it's effective too. Nowadays, breast cancer death rates, despite the increased incidence of it, is going way down. 90% of women now are cured of their breast cancer through effective treatments.
It's my birthday gift, doctor, to myself. Every year I've talked about it on the show often. Right around my birthday, the mammograms, the screening, the yearly checkups. It's just so important to get that done. And I know it can be scary, maybe. Is that the reason why women don't want to do it? Or?
I think people do hear the word cancer, and they sometimes feel like, I'd rather not even know that I had cancer, but early detection is the key to cure. There's a lot of reasons we're seeing decreased death rates, but perhaps the most important is that people are being screened and detecting the disease early.
What can you share about the specific type of the disease, the inflammatory breast cancer? What is that?
I'm glad you raised that, because this is an unusual subtype of breast cancer that I have a particular interest and passion for. It tends to be representative of only 5 to 7% of all breast cancer, but it's unusual enough that it's commonly misdiagnosed. Things that are the hallmarks of it, it tends to happen in younger women, and unlike regular breast cancer that forms a mass in the breast, this involves the skin of the breast, causing breast redness and swelling, and often is misdiagnosed as a breast infection. And it's important that people are aware of this condition, because it needs to be treated very aggressively and very early.
Beyond all the medical treatments, that so much has changed over the years of what is available, are there other support services available to women now?
Yeah, at Scripps Cancer Center, we really pride ourselves in having a very team-based approach. So the therapy doctors, including a surgeon, a medical oncologist, and a radiation oncologist, also have doctors like pathologists and diagnostic imaging doctors helping. But in addition, we surround the patient with patient support groups, physical therapists, social workers, oncology dietitians, oncology pharmacists. It really takes a whole team of healthcare providers to give comprehensive care that a breast cancer patient needs.
Well, we appreciate you stopping by during this Breast Cancer Awareness Month. I know we're going to be talking a lot about this throughout the entire month. And I think the big takeaway for anybody watching right now is, if you haven't scheduled that mammogram, doing that screening, go do it, because that early prevention really, really makes a difference.
Thank you.
Doctor, thank you for being here.